and welcome to Conversations in Public Relations. I'm your host, Mary Fletcher Jones. Today we're at the DC offices of Bruder Finn, a public relations agency, and I'm so excited to be talking to Sara Latham, who is their Senior Vice President for Healthcare. Sara, thanks for being here with us today. Can you tell us more about yourself and how you got started in public relations?
I had always been interested in healthcare and healthcare policy, and during college took many courses in those particular areas. Upon graduation of college, I actually found out about an executive training program at Bruder Finn and applied for that training program and luckily was received into it, whereupon I joined the healthcare practice, and that began my interest in public relations, which I've stuck with ever since.
So what do you like about your work?
In terms of working in public relations, what I like best are the relationships that I have both with my colleagues and my clients. Being in the communications sector, it's very important, obviously, to maintain relationships with people, constantly be talking to them, learning what's driving them, learning what they think is new, interesting, exciting. And being in this particular position and in the public relations industry really allows me not only to stay up to date with very current events, but it really brings me into contact with people I don't think I would necessarily come into contact with.
So you work in healthcare public relations. Can you describe for us why that's so important right now?
First of all, at no other time in history have we had so many medical breakthroughs and innovations. And that is really spurring a lot of interest, not only from the research part of things, but in terms of drug development, in terms of finding new therapies, and also identifying diseases that perhaps we didn't understand before or didn't have a full grasp of. So that would be one reason that I think healthcare public relations is so important. The other reason I think that it's important is I think that there's been a real power shift from the medical profession to the patient. Patients are much more educated and aware than they ever have been. I think they're less fearful about asking questions of their doctors and their healthcare professionals. And I personally think that's a very positive thing. It encourages dialogue between the two, and it also allows there to be more media attention on particular areas that perhaps were not discussed.
So Sara, in what ways is your firm using digital media?
One example that I have is we recently launched a website entitled healthierforum.com, in which it looks at interesting news that's taking place within the healthcare sphere. Right now that happens to be healthcare reform, and has commentary on what is actually happening through a panel of advisors and others. And so this, I think, is one area where increased dialogue and interest can really show the importance of social media.